Mission of Mercy brings doctors to underserved populations throughout Maricopa County in the communities where they live and work at a lower operational cost than a regular standing clinic. Our mobile healthcare model opens the doors to greater serving capacity, drives better health outcomes, and reduces unnecessary visits to costly emergency departments. Mission of Mercy's free patient-centered primary healthcare services, delivered by a 95% volunteer medical team, empower our patients along their unique journeys of hope and healing. We see patients from all walks of life, from the refugee population, to seniors who lack access to Medicare, to the working poor who are living paycheck to paycheck. Our goal is to help patients like John, who first came to our North Phoenix clinic location after losing his job and consequently his health insurance due to the pandemic. When John came to us, he was desperately in need of help stabilizing his type 2 diabetes. Mom's medical staff prescribed diabetes medications, and he met with the clinic's certified diabetes educator to establish a lifestyle plan that would help John begin his journey toward hope and healing.
Our patient John was a construction worker. He was laid off during COVID and then became an independent contractor. He was just making enough to pay his bills and could not afford insurance. With a long family history of diabetes, he was a little bit shocked as a very thin person to learn that he had diabetes himself, type 2 diabetes. So not having a place to go for care, a friend recommended to him that he call Mission of Mercy.
My mother, sister, grandfather, even a niece, we got 4 generations in a row of diabetes, and I never thought I would have it, but it turns out I do. I didn't know how I was going to go to a doctor, and what I really didn't want to do is wind up on insulin like my mom and my sister. Thought I could maybe get on Access or something like that, and turns out I made too much money, but I didn't make enough to pay for health insurance. So Mission of Mercy has helped me with my diet, medications. The on-site pharmacy is amazing. I also have a thyroid condition, which Dr. Smith has been helping me manage. What surprised me about Mission of Mercy is that after coming here on a regular basis, they remembered my name. I thought they actually do care. They do remember.
He has really found that his meds are helping him so much, but not only that, it's really the time that the staff and the volunteers take with him on his healthcare journey that make him feel like he has that hope, and he feels better, and he can see how everything is working to help him feel better every day.
People want to feel good. They want to wake up every morning and go to work and be able to provide for themselves and for their families. And that's what Mom enables people to do. They provide that service, that medication, so they feel good. And that's what everyone truly deserves.
When patients find Mission of Mercy, they find their hope. They've been turned away from so many places, and because they lack insurance, because they lack the financial means to pay for services out of their pockets, they struggle to meet their family's daily needs, food, shelter, utilities, and it makes it really difficult for them to sustain life for their families. When they find Mom, their hope is restored, and they can begin their healing journey in a safe, reliable medical home surrounded by caring staff and volunteers who truly love what they do.